Welcome to RevMD Sex Fights podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombieski, nurse practitioner here at RevitalyzeMD.
Backed by popular demand, PT-141 or Bremelanotide. So we're going to do just some quick bullet points on some questions we're always asked.
What is it? Who can take it? What does it do? How to take it? The side effects and
how do you get it?
All the questions. So definitely like, subscribe if you like what the content that we're putting out, and we'll get right to it.
Yes.
So go right on, Dr. Durst. What is it? I didn't forget.
I know. So what is it? So Bremelanotide or PT-141 is a peptide. It's a sexual peptide. There's details that we went into in a longer video, and refer over to that one if you want other details. But a peptide,
so if you want the science, look for that one.
If you want deeper science, we did it there. It's a peptide. It works on the brain to improve sex drive and function in men and women. So who can take it? Who would this be indicated for? If you are a man or a woman with low sex drive, or a man or a woman that have a decreased orgasmic strength or erection quality, then you would be a candidate.
That low desire.
For PT-141. Yeah. Yes.
So this is not a end-all be-all. If you have no testosterone, you need to replace testosterone. If you have no function, this is not going to do it on its own. But it is the icing on the top, as we like to say. It is one more tool that you have that you can utilize to improve that sexual desire. But for most with severe erectile dysfunction, this is not going to be the only thing that you use.
It's part of a comprehensive plan. So basically, we address comprehensive or sexual dysfunction for men and women in a comprehensive way. So hormone optimization if you need it, and basically regeneration. And peptides are just, again, like Faraday said, the icing on the cake. And it's one of the tools. And we definitely love it. And you will love it too. When you do, you have to get used to a couple things. So what are some side effects? Nausea could be one of them. Again, it's worse at the beginning, worse with higher doses. You'll acclimate to it. So it's not something you want to take on your honeymoon for the first time. Yes. So timing's important. And then of side effects, and you want to minimize that. And then also, when's it going to work?
Nausea was reported in over 40% of the people that took it. Correct. So definitely something that when you take it, I would just go ahead and say, I'm going to get nauseous, and what am I going to do about the nausea when it happens? And if you don't, then you're one of the lucky ones, but plan for it.
And there's some simple over-the-counter stuff you can use, or a prescription from whoever's prescribing it. So basically in timing, it might work in 30 minutes, it might work in 5 hours. You got to get timing down for you and acclimate to those side effects. And then where can you get it? It is a prescription, so you have to get it from a physician or provider, and so that requires a medical evaluation.
And how does it get administered? It is an injectable. Dosing varies significantly patient to patient. There is a sliding scale that is used, so we won't go into dosing. That's something that is very specific by the concentration of the medication, what you're using it for, who's using it, by gender, and again, probably the biggest thing is, are we using it for the desire? Are we using it for erectile dysfunction? So all of those things would play a part in what your dosing would be. So dosing does change significantly person to person. So we won't go into dosing on this video. That would be between you and your provider that's prescribing it. But it is an injectable.
And the dosing is huge because, again, it is approved by the FDA for one indication, and that's hypoactive sexual desire disorder with women that are premenopausal.
Yes.
So not postmenopausal, which is common, and nothing in men so far. So that is a one-size-fits-all, one dose, and a pre-filled syringe that's quite pricey. And it looks like even on like GoodRx, and we looked at it, not available maybe. But the bottom line is that you really want to adjust this one and titrate up or down depending on your needs. It's not a one size fits all because, as Faraday said, it depends on your medical conditions, what you're using it for. Is it low sex drive? Is it poor erection strength?
And side effects. If it makes you nauseous on a higher dose, can you still have the benefit that you desire on a lower dose and just not be as nauseous on it?
Correct.
So it does need to be tinkered with a little bit to find what's best for you.
That's huge right there, is that lower can always make it better and fewer side effects. And so basically that's important. Not one size fits all. It's part of the comprehensive. And again, what right now can we use in traditional medicine to treat low sex drive in men? and low sex drive in women.
So for men, you guys have lots of options. Not super comprehensive in traditional medicine, but lots of options. We get a pill, right?
Yes. Yeah.
Viagra Cialis. We've got an injectable,
Mhm.
like Trimix if needed.
Yeah.
We've got hormone replacement, testosterone, if your primary prescribes it. So there are some options out there. For women, there really isn't much.
There's nothing for women when it comes to low sex drive. No FDA approved, testosterone. So, and not a lot of providers, and definitely traditional medicine or gynecologists that are doing testosterone optimization in women, although it's just a gender bias. And so there are ways, and we do need to optimize testosterone for women to get their sex drive back. But if you're looking at erections, and then that's when you're looking at Trimix and Viagra Cialis, or the little blue pill for men.
Pumps.
And penis pumps. And you can have a penile implant. But what do women have as an option for treating poor orgasmic strength and quality? Nothing. Nothing that traditional medicine is offering.
There is a FDA product for PT-141, but as Dr. Durst said, it's very expensive. It seems like it's only going through maybe one pharmacy or a specialty pharmacy. And then there is another one, Addie, but it hasn't had great reviews from patients that we know of.
No. So that's why they wanted to bring this to market, is to try and give women an option. But honestly, there's lots of options for women, and I think that both men and women need to know this, so that if you have a woman that is experiencing poor sex drive or low orgasmic strength or no orgasms, that there are solutions for that, and there are plenty of solutions.
Yeah.
And
send them over to our podcast, because we have a ton of content for women and what we can do for sexual wellness.
And again, they're as bothered by it as you are. If you're not having the conversations, we can tell you, because we talk to them on a daily basis, and they come in because it bothers them, and they're sad and they're distressed over the fact. And in fact, there's lots of data and studies to show how distressing it is for women. And again, but there's solutions now. So if you haven't found that in your traditional doctors, your GYN, your primary care doctor, then you need to find a sexual wellness office that does it well. And so there's solutions for you.
Both men and women.
Yes.
We don't have many medications that we say we can use for both men and women in this field.
Yeah.
Or in this realm of medicine of sexual wellness.
No, although we will say that hormones and testosterone is both for men and women too. So that optimization, and it does appear that it is more for men with the low T clinics, but it's not. It should be used for women as well. And so this is another one. So you're right. We have two now that we really, for this part of regeneration and sexual wellness, have for both men and women. So hopefully that addresses the major points. So if you have any other questions, any experiences with PT-141 that you would like to share, please let us know. Like and subscribe if you like content that helps you have a better sex life. And we're willing to deep dive into anything sexual wellness, but wellness and aesthetics as well.